Have you ever walked into a doctor's office feeling perfectly fine and walked out feeling worried, confused, and suddenly afraid of your own body? Maybe it started with one routine test, just to be safe. Then the result came back with one small abnormal finding. Then came another test, then a specialist, then a biopsy, then a procedure, and somewhere along the way, you stopped feeling like a healthy person and started feeling like a patient. If you are over 70, this conversation matters, because after a certain age, more testing does not always mean better health. Sometimes a test can help you. Sometimes it can save your life. But sometimes, especially when you have no symptoms, one test can start a medical cascade that brings anxiety, procedures, complications, and a loss of confidence you may never have needed in the first place. I'm Naya Vell, and today I want to walk you through 5 medical tests that people over 70 should not automatically accept without asking important questions first. This isn't about avoiding doctors, this isn't about ignoring symptoms, and it is not personal medical advice. If you have pain, bleeding, chest pressure, unexplained weight loss, sudden weakness, or any new serious symptom, you should speak to a medical professional. But if you feel well and a test is being offered only because of your age, then you deserve to understand the full story before you say yes. Because the most important question is not, can this test find something? The real question is, if this test finds something, will my life actually be better because of what happens next? That question can protect your independence. It can protect your peace of mind. And in some cases, it can protect your body from procedures you may never have needed. Let's start with the idea that connects all 5 tests. It is called the Cascade effect. Here is how it usually happens. You feel fine, you go in for a routine visit, someone recommends a screening test. The test finds something small, maybe a spot, maybe a number that is slightly off, maybe a shadow on an image, maybe a word in a report that sounds frightening. Now, that finding may be harmless. It may have been in your body for years. It may never cause a symptom. But once it is written down, it becomes very hard to ignore. So the next step is another test, then a specialist, then more imaging, then maybe a biopsy, then maybe treatment. And each step has its own risks: bleeding, infection, sedation, falls, confusion, pain, anxiety, lost time. And sometimes, after all of that, you find out the original finding was never going to hurt you. That is the cascade. And the older we get, the more important it becomes to ask, is this test likely to improve my life or just start a chain reaction? Now, let's talk about the first test. Number 1, full body scans when you have no symptoms. You've probably seen these advertised. A scan from head to toe, a full body CORT, a full body MRI. The promise sounds beautiful. Find disease before it finds you. Catch problems early. Know what is happening inside your body. And I understand why that feels comforting. When you're over 60 or 70, it's natural to want peace of mind. You want control. You want to know you're okay. But here's the part many people aren't told clearly. When you scan the entire body of a person who feels well, especially an older adult, you will almost always find something. A small lung nodule, a kidney cyst, a spot on the liver, a tiny thyroid nodule, a shadow, a change. A word in the report that says, follow-up recommended. And in that moment, everything changes. You went in feeling healthy, you came out with something to worry about. Now every cough feels different. Every stomachache feels suspicious. Every small pain becomes a question. Is it growing? Is it cancer? Did they miss something? 3 months later, you go back for another scan. Then another one. Then maybe a specialist says, we should biopsy it just to be safe. And now, you are no longer dealing with a picture. You are dealing with needles, sedation, bleeding risk, infection risk, and weeks of fear. Here is the important distinction. A scan is very useful when there is a real reason for it. a symptom, a known condition, a specific risk, a follow-up your doctor can clearly explain. But scanning the whole body when you feel well is different. It often finds things that are not dangerous, but once they are found, they can be very difficult to leave alone. So before agreeing to a full-body scan, ask this: what specific problem are we looking for? If this finds a small abnormality, what is the next step? And is there evidence that this scan helps people like me live longer or better? If the answer is vague, if the reason is just peace of mind, be careful. Because sometimes peace of mind is exactly what the scan takes away. A better health check for many people over 70 is not a picture of every organ. It is function. Can you get up from a chair without using your hands? Can you walk across a parking lot without stopping? Can you climb stairs without chest pressure? Are you sleeping well? Are your medications making you dizzy? Are you eating enough protein and fiber? Do you have balance problems? These simple things often tell more about your real health than a scan ever could. Remember this: the goal after 70 is not to find every tiny thing inside the body. The goal is to protect your strength, your independence, and your ability to live your life. Number 2, routine PSA screening after 70. This one is for men, and it is important. The PSA test is a blood test used to screen for prostate cancer. For some men, at some ages, it can be part of an informed conversation. But after age 70, routine PSA screening becomes much more complicated. Here is why. Many prostate cancers in older men grow very slowly, so slowly that they may never cause symptoms. They may never threaten your life. They may never need treatment. But if a PSA test comes back high, it often starts a chain. Repeat blood work, a urologist, an MRI, a prostate biopsy, and if cancer is found, even a low-risk cancer, many men feel pressure to treat it. Surgery, radiation, more procedures, more appointments, more fear. And these treatments can have life-changing side effects: urinary leakage, sexual problems, pain, stress, a change in confidence, a change in daily life. Number 3, brain MRI for mild, everyday forgetfulness. This one touches a deep fear: the fear of losing your memory, the fear of dementia, the fear of losing yourself. Maybe you forget why you walked into a room. Maybe you cannot remember someone's name right away. Maybe you misplace your keys. Maybe your adult children get worried and say, "You should get a brain scan just to be safe." That fear is understandable. But for mild, everyday forgetfulness, a brain MRI can sometimes create more anxiety than clarity. Here is what often happens. You get the MRI. Then the report comes back with words that sound terrifying. Age-related changes, small vessel changes, brain volume loss, white matter changes, mild atrophy. If you are not used to medical language, those words can feel like a diagnosis. You may hear them and think, "My brain is failing. Dementia is coming. I am not safe anymore." But many of these findings are common as people age. They may not explain your symptoms, they may not predict your future clearly, and they may not change what your doctor does next. A picture of the brain, you see, it's not the same thing as how your brain is working in real life. I mean, I've seen people with scary-looking scan reports who still manage their money, read books, remember appointments, and live independently. And then, I've seen people with serious memory problems whose scans don't look dramatic at all. Function, well, that really matters. So if you are worried about memory, the better first step is often not a scan. No, it's a real memory evaluation. Simple office tests, a medication review, a sleep review, a mood review, blood work, for things like B12 or thyroid problems, checking for depression, checking for sleep apnea. checking whether a medication is making you foggy. Because many causes of memory complaints in older adults are actually treatable. Not always, of course, but often enough that they really should be checked. Well, if memory loss is getting worse over time, if you're getting lost in familiar places, if you can't manage bills or medications, if your personality changes suddenly, if there are new neurological symptoms, or if your doctor sees a reason to look for stroke, tumor, bleeding, or another serious issue, that's different. But for normal, mild forgetfulness, please don't let fear alone push you straight into a scan. Ask, what are we trying to rule out? Will the scan change my treatment? Can we first check the common reversible causes? And most importantly, are we measuring how my brain functions or only how it looks? Because you, my friend, you're not a scan report. You're a person. Number 4, cardiac stress testing when you have no symptoms. This one sounds very sensible. You are over 70. Someone says, let's check your heart. Maybe you are preparing for a procedure. Maybe it is just part of a routine checkup. You have no chest pain, no unusual shortness of breath, no fainting. You walk around the grocery store. You climb stairs. You garden. You take walks. But someone says, at your age, we should do a stress test. Now, stress tests can be very useful when there are symptoms. Chest pressure with walking, shortness of breath that is new, unexplained dizziness, fainting, a concerning heart history. Those are real reasons to investigate. But routine stress testing in someone who feels well can create problems. Older adults can have false positive results. That means the test suggests something is wrong, even when there may not be a dangerous problem. But once the result is abnormal, the cascade begins. More tests, cardiology referral, maybe a cardiac catheterization, maybe a stent, maybe new medications, maybe blood thinners. And even if nothing serious is found, the psychological label can stay. You start thinking, my heart is weak. I should stop walking. I should not climb stairs. I should not push myself. And suddenly, a test that was supposed to protect you may make you less active, less confident, more afraid. That's why most active information was feeble. In the end, a problem of concern came under these informations, and the fact that in the movement would solve and fade and know every moment in the moment. Here is a simple idea. Your daily life, it gives important information. If you can walk at your usual pace, if you can climb stairs, if you can do your normal activities, without chest pressure, unusual breathlessness, fainting, or severe dizziness, your body, it's already telling an important story. Now, that doesn't mean you never need heart testing. It means testing should match symptoms, risk, and purpose. So before a routine stress test, ask your doctor, what symptom or risk are we investigating? What are the chances this test gives a false alarm? If it is abnormal, what's the next step? And could that next step actually improve my life? That, my friends, is how you stay in control. Because after 70, the question isn't, can we test the heart? Of course we can. The question is, will this test help me make a better decision? Number 5. Routine colonoscopy after 75, when previous screenings were normal. Let me be very clear. Colonoscopy is an important tool. It has helped prevent colon cancer. For many adults, especially from middle age through the early senior years, screening is valuable. But after 75, the decision becomes more personal. It should not be automatic. Here is why. Colon cancer often develops slowly. A small polyp may take years to become dangerous. So if you are 78 or 82, and your previous colonoscopies were normal, and you have no symptoms, and you are average risk, the benefit of another routine colonoscopy may be smaller than it was when you were 55 or 60, but the risks may be higher. The bowel prep can cause dehydration and weakness. The sedation can cause confusion or breathing problems. The procedure itself has a small but real risk of bleeding or perforation. And for an older adult, a serious complication can mean hospitalization, loss of strength, and sometimes loss of independence. That is why this decision should depend on you, your health, your past screening history, your family history, your symptoms, your preferences, your life expectancy, their ability to tolerate the procedure. Now, do not misunderstand this. If you have blood in your stool, persistent changes in bowel habits, unexplained weight loss, iron deficiency anemia, or a strong family history, that is not routine screening anymore. That is a diagnostic conversation, and a colonoscopy may be important. But if you feel well, have had normal screenings before, and are being told, you need this just because of your age, pause and ask, given my previous results, what is my actual benefit? What are my risks at my age? Are there less invasive options? What happens if we do not do this test right now? And what symptoms should I watch for instead? This is not refusing care. This is choosing care wisely. Now, let's just step back for a moment. What do all 5 of these tests really have in common? Full body scans, routine PSA after 70, brain MRI for mild forgetfulness, stress testing with no symptoms, routine colonoscopy after 75. The common thread here isn't that these tests are bad. Oh no, they're not bad at all. Each one can be incredibly useful, in the right person at the right time for the right reason. The problem, you see, is automatic testing. Testing without a clear question. Testing without discussing what happens next. Testing that treats age alone as a reason. So, I want to give you 5 questions to bring to your next appointment. Write these down, if you can. Question 1. What exactly are we looking for with this test? Not generally, specifically. Question 2. If the test is abnormal, what happens next? Because the next step matters as much as the test. Question 3. What are the risks of this test for someone my age? Not for a healthy 45-year-old, for you. Question 4. Will the result change my treatment in a way that improves my quality of life? This is the question most people forget to ask. Question 5. What are my alternatives? Could we watch symptoms? Could we repeat blood work later? Could we review medications? Could we focus on strength, balance, nutrition, and function? Could we make a decision together? These questions do not make you difficult. They make you informed. A good doctor should welcome them. Because your healthcare should not feel like a conveyor belt. It should feel like a conversation. And after 70, that conversation becomes even more important. Your goal is not to collect perfect test results. Your goal is to stay steady on your feet, to keep walking, to keep thinking clearly, to sleep better, to protect your independence, instead of fear. Sometimes the right test is exactly what you need. And sometimes the healthiest decision is to pause, ask questions, and avoid a cascade you never needed to enter. So, what is the most full line in what you might not understand will be your life. You are allowed to ask why. You are allowed to ask what happens next. You are allowed to ask about risks. You are allowed to ask if waiting is reasonable. You are allowed to say, I want to understand this before I decide. That is not being difficult. That is protecting your life. Now, I want to hear from you. Have you ever had a routine test that led to more worry, more procedures, or more confusion than you expected? Tell me your age and where you are watching from. And tell me which test you think people over 70 should ask more questions about. Your story may just help someone else feel less alone. If this conversation helped you, subscribe for more clear, practical senior health guidance. And remember, the goal is not more tests. The goal is better decisions. Take care of yourself, ask the right questions, and protect your independence.